My name is Dr. Brandon Thornberry. I'm one of the veterinarians partnering with your veterinary hospital and wanted to share a veterinarian's approach to a cat that is vomiting. A cat that's vomiting is a very common thing that we see in a veterinary hospital. And so by inviting you into our headspace and our mindset, we believe that you can ask really good questions to your veterinary team and then get the best care possible for your pet. Everything usually starts off with a good history. So the acronym that I usually follow is what's called DEMO. D stands for diet. So what diet is your cat currently on? Are any changes in diet? E stands for environment, so any changes around the household or other cats or dogs having similar symptoms. M is medication history, so any meds that they're currently on or anything that they've been given for vomiting that has worked or not worked. And then O stands for other symptoms. So not uncommon for us to see a cat that's vomiting and having diarrhea, or vomiting and having weight loss, or vomiting and having urinary changes, either inappropriate urination or urinating more or less. So all these things can build a case for where we take things next. It's a really important part of our physical exam to focus on head to tail, because there can be issues that can arise outside of just the abdomen as far as causing your cat's vomiting. Listening, for example, to the heart and lungs. If I listen to a fast heart rate that's got a murmur or a gallop rhythm, that can be suggestive of what's called hyperthyroidism, which can manifest in some cats as vomiting as the only outward symptom, but on physical, I can detect other things that can maybe build a case for that being the situation. So we're gonna do a full head-to-toe physical, and then we're gonna proceed into our diagnostic tests. And there's usually three common tests that we start off with. The first one is a stool sample, screens for common parasitic causes for a cat that's got vomiting or other symptoms. The next test is abdominal x-rays. This screens for, as you would imagine, things that maybe were ingested that maybe shouldn't have been. We can get a good look at the stomach and the intestines and the architecture of the abdomen to make sure that we're able to see what our hands can't feel. And then lastly, we do some blood work. Blood work screens for causes outside of the GI tract, like the liver, the kidneys, the thyroid levels, things that can be involved in your cat's vomiting that we can't always see or feel on physical. And so after we perform those initial diagnostics, we're always best suited to treat what we diagnosed. So those common diagnostics are really important to start off with. Treatment can range in a huge variety, from anti-nausea medications that we can give by mouth or injectable, because we know it's hard to medicate cats. There can be some topicals for appetite stimulant that we can kind of give as well, potentially on the ears or by mouth. There also usually is a dietary reset, something bland, easy to digest that can allow the tummy to reset over the coming days. There are some pets that need fluids if they become dehydrated due to vomiting. So we can administer fluids underneath the skin or potentially hospitalize them for a period of time to give them IV fluids through a catheter. And then lastly, some cats do need to be hospitalized with us because they can't hold things down or they're battling multiple symptoms. So hospitalization can be a really important part of their care. So in summary, I wanted to share with you all that a really thorough history and a head-to-toe physical are really important in our approach to a cat that's vomiting. The common triad of tests that we reach for are stool sample, x-rays, and blood work, because that allows us to cast that net out really wide to determine the reason for your cat's vomiting. Once we determine the reason, we're better suited for treatment options.